Thank you, everyone. And we will now be moving to the patient videos, highlighting pain points and having a discussion around them. Today, we will be covering therapy areas of diabetes, arthritis, and lastly, acid peptic disorder. The panel discussion will be followed by the patient or caregiver videos in each of the three therapy areas. I want to acknowledge my gratitude to each one of them who have contributed to the videos. Before proceeding, I wanted to put a disclaimer. Can we have a print of that? I hope everyone can see my screen, and the disclaimer states that all opinions, views, feedbacks, data, images, videos, interviews, or any other material shown during this event is purely for the learning and academic purpose of the subject, pharma brand management. None of the views or opinion expressed by the speakers in live mode or as recordings are to be considered as endorsement of any brand either. This event is a non-commercial, purely academic event, and the content, recording, or any part of this event cannot be used for any commercial purposes. And with this, I can start. I want to request our esteemed speaker, Chinmay sir, Vivek sir, Mr. Alhad Mahajani, Professor Voldemort, to intervene in between also as we go ahead with the insights from the relevant therapy areas. Before I begin with the therapy areas, I would like to welcome panel chairperson, Mr. Bhupati Roy, Executive Director of Marketing at Healthcare Pharmaceutical Limited. He has over 30 years of experience in the field, starting as medical representative and working his way up to marketing manager. He is an accomplished marketing professional and we look forward to his insights on the subject. Over to you, Bhupati Roy, sir.
Hi, Shazia. Thank you very much. So thanks to all the members of Pharma State for organizing such a beautiful session. I would like to express my thanks to Vivek sir for his wonderful initiative. I also would like to express my thanks to Professor Azad Khan sir, the speaker of today's program, Professor Chitra Moitro, Professor Vivek sir, Professor Chinmay Mitro, Mr. Alhad, Ms. Shajia, and Ms. Shati. So thank you very much.
Okay. We would like you to be here for the whole panel discussion, these sir, and enlighten us again towards the end too, after the panel discussion.
So should I tell some?
Yes, yes, sure.
Okay, okay. So if we look at the pharma industry worldwide, actually they are heavily focused on healthcare professionals and prescribers and the prescription and eventually the business. If we look at the mission and vision statement of all the major pharma companies worldwide, there are some elements, some points there about patient centricity, patient caring, but in reality, it is mostly focused on the healthcare professionals and prescribers. Unfortunately, it is very unfortunate that despite the pharma industry has so many contribution for the human being, breakthrough innovations, novel purpose, life-saving discovery, for the benefit of the human being and the patients. Still, in general perception, is that the pharma industry is for the business and for profit. So pharma executive needs to do much better job. Beyond that, to make people, the general people and the patients, to believe that they are doing the right job and they are doing something great for the human being, for the benefit of the patient, not just for the money making industry. So this is very important point. Vivek sir, is that okay with you?
Absolutely, sir. Absolutely.
Okay. So in pharma, actually in pharma industry, no patient, no business. Patient is a main focus for business. Even in healthcare sector, healthcare sector means I mean the healthcare professionals, clinics, hospitals, all this, and the pharma industry. For both, patients are the main. So no patient, no business. So patients are becoming more knowledgeable, more influential day by day. So patient centricity is now becoming more vital for pharma industry too. I believe so. So patient centric culture is already is there, especially in innovative company for R&D, for clinical trial, for new drug discovery, which can truly impact the condition of the disease or the patients. So it is already there at that level. But if we consider in the later part of the pharma industry, where the commercialization, so there is something still a lot of things to do. I think that is the time has already come, and maybe so far I know there are companies they are doing some initiative is there to how to benefit the patient, how to become more patient centric, how to help the patients more to alleviate the disease, to alleviate their side effects, all these things. The benefit of the patient centric marketing in pharma are that the patients will feel more engaged, and there will be more greater trust between company, healthcare professionals, and the patients. And patients eventually will experience improve outcome out of his treatment or therapy or the management, whatever it is. However, this patient centricity is a complex dynamic for especially for the pharma industry. Why I'm telling this, because there are a lot of challenges are there. Number one is the regulatory issue, compliance issue, and also the patient's secrecy or patient's right, all these things. So these are the things we must look before we think the patient-centric approach from the pharma commerce who are doing the pharma commercialization. Finally, I would like to conclude like this. There is a need for transformation of thinking of executive of the big pharma, as well as there is a strong need for a very good collaboration between pharma industry healthcare industry, healthcare professionals, caregivers, patient support group, and last but not the least, the big tech company like, for example, Apple, Google. We can make a collaboration between them because all these data are there. These data will help. We can. Pharma industry do not have this expertise to get all this data and analytics capabilities. So in any case, if some company wants to focus on patient-centric approach, it is, I think it is inevitable to collaborate with big tech giants. For example, I can tell you one story. One thing is Johnson and Johnson. They have done a good initiative with Apple for atrial fibrillation. So whenever there is some abnormality, the data goes to the respective healthcare professionals, and there is a system. Then the ambulance come to the patients, taken to the hospital and taken care. So this is this kind of initiative can be done, but I think it is started already. So eventually we will have in future we will have more patient-centric approach in pharma industry, and let's see how quickly we can move to that. Because in any case, there should be a change in the mindset of the executive that everything, whatever I do, is focused on keeping the patients in the middle. Thank you very much.